In this question, a 2-day-old newborn develops tetany. Physical exam shows dysmorphic faces, low-set ears, micrognathia. Lab studies show a serum calcium of 7.2 milligram per deciliter, which is low. Which of the following chromosomal abnormalities is most responsible for the findings seen in this patient? Now, the first and the most important clue to this question is going to be hypocalcemia. Okay, and then this is a 2-day-old newborn with tetany. So this baby is born and immediately the baby starts having a tetanus, having tetany. So that is not good, right? I mean, we should be already thinking of congenital problems that can cause hypocalcemia. And the first thing that comes to my mind is going to be DiGeorge. Now I'm going to match to see if the other features of the vignette kind of matches my diagnosis in mind. This baby has a dysmorphic face with low-set ears, with microctania. So all these syndromes is telling me that this is pretty much DiGeorge syndrome, right? Now, DiGeorge syndrome is abnormality of chromosome 22. Deletion of chromosome 22 gives rise to DiGeorge syndrome. So what are some of the other things we see with DiGeorge? With DiGeorge, we see defect. What are the defects do we see in DiGeorge? By the way, you'll be able to read up more on this from page 237 from first aid. So from the defect, we see it's going to be 22q11 deletion. That is what causes DiGeorge. This is due to underdevelopment of third and fourth pharyngeal pouches. This is what really causes DiGeorge. There is going to be, and the third and the fourth pharyngeal pouches is also going to give rise to parathyroid, and that's why with the lack of parathyroid, they're going to have tetany. Okay. Also, in the same region, and the third and the fourth pharyngeal pouches, this also gives rise to thymus, and without no thymus, there is not going to be no T cells. Our T cell maturation doesn't happen. When there is no T cell maturation, the patient is going to be more prone to viral and fungal infections, right? That's also going to happen. Okay. And last of all, I would like to add that they're also going to have congenital heart problems, and also great or big vessel problem. Great vessel abnormalities. Okay. Great vessel abnormalities. And last of all, I'd like to conclude that since they have no thymus, they're not going to have any T cells, or decreased T cells. Since they have no parathyroid, there's going to be decreased parathyroid hormone and decreased calcium.